Paws up, pet pals. Welcome to Arden Moore's Four-Legged Life Show. I'm your host, Arden Moore. She's back. And this time, she is here to help our fine felines who are in pain. Our first guest today is one of the world's foremost experts on pain management in pets. And she's a pretty cool person, too. Please give pause and applause to the founder of the Downing Center for Animal Pain Management in Windsor, Colorado. And I'm talking, of course, about Dr. Robin Downing. Welcome back to the show, Dr. Robin.
Thanks so much for having me back, Arden. It's really a pleasure always to speak with you.
Well, a while back, we focused on dogs and how to deal with pain in dogs. This time, we're going to zero in on our feline friends. And I have a little background in cat behavior, written some books, but I'm in esteemed company right now with Dr. Robin. But the one thing I always tell people are cats are not little dogs. Right. They're a pretty unique species, right, Dr. Robin?
That is so true. When I teach about pain and pain management, I always make certain that I state out loud so everyone can hear it, that cats are not small dogs. A, we can't think we're going to see issues with them the way we see issues in dogs. And B, we can't treat them the way that we treat dogs. So many of the tools we have to treat various conditions in dogs either can't be used in cats because it will murder them, or they're ineffective in cats.
Yeah. And I know they're both prey and predator, so they're always hunting while we're being wary of not being hunted, even indoor cats. Because I call it affectionately, they have 5 weapons of mass destruction, teeth and claws. They could be a little more challenging to deal with when they're in pain than a dog.
That's so true. And one of the things that, one of the persistent myths among cat owners is that at some point, cats will just stop doing cat things. So for instance, I hear from my cat owners who have cats that are becoming elderly. Well, she doesn't like to jump up and sit in the window and watch the birds anymore. She must be getting old. Or she doesn't jump up on the bed and sleep with me at night anymore. She must be getting old. Or he used to chase the laser pointer and now he's just not that interested. He must be getting old. And anytime I hear that, that is a total red flag that yes, in fact, before me is a cat who is suffering silently, because you said it. They are predator animals. And they know that if they can't predate, if they can't hunt, they might become someone else's lunch. So it is in their best interest, as far as they're concerned, to mask any weakness, to mask any inability to be that predator. And that's where masking pain becomes. They're artists at doing that.
And that's not a good thing. I have a 17-year-old cat, Mikey, and he meows like this. I don't know if he secretly wanted to be on stage and doing an operetta. I don't know. But I pay attention to him, and he just got his senior wellness exam, and he's doing well. But I do think little things to make him be able to get up on the couch easier, on our bed, things like that. 17 is a good years, but he still licks the head of Kona, my dog. He still eats. He still talks to you. He's still, he's very active. So I know cats sometimes live longer than dogs, but because they, as you say, mask their pain, it seems like we as cat parents or cat owners, we need to be more tuned into our kitties, right? Yeah. What are some signals that are starting onset that maybe our cat may have some chronic pain, and we'll get into acute pain in a bit?
So, excellent question. And this is where veterinarians and cat owners really need to partner. So some of the signals I already mentioned, changes in behaviors. So not going vertical, not getting up on the bed, not running up and down the stairs. But some other very important signals include a change in litter box behavior.
Oh,
there are cats that become chronically painful. They may have pain in their back or their hips, and it's no longer comfortable to climb into the litter pan, so they may urinate or defecate inappropriately. And we as cat owners may misinterpret that as bad behavior. Well, it's unacceptable behavior, but it's not bad behavior. They just physically are challenged to get into the litter pan. We may see changes in eating behavior because there may actually be something like oral pain, dental pain from teeth that are causing a problem. The other clue, though, that you can see across the room is a cat who becomes unkempt. Their hair coat becomes unkempt. Cats are very, very fastidious creatures. And with
I know, I'm
rare
always
exception,
getting grooming tips from Casey. He's like,
Exactly.
Art, you need to fix your part on your hair. You look awful. No good cat would walk out the door looking like you.
Exactly. So with rare exception, and I owned a cat who was a long-haired cat who could not take care of his clothes, and we had to give him a lion cut every so many months, starting when he was 5, because he was terrible about taking care of his wardrobe. But most cats are meticulous about their hair coat. And so if we see clumps, if we see particularly over the back end, behind the waist, over the hip bones, the rear legs, the tail, where the hair gets clumpy or it gets matted, that is a huge signal that they're experiencing chronic pain. And that's a real red flag to call the veterinarian and say, I really think my cat needs to be seen.
Now, in your previous guest spot, you've been a veterinarian for a long time, and I do want to brag, everybody. She did win in 2020. This is a big deal. And I'm probably saying his name wrong. Leo K. Is it pronounced Bustad? Bustad, Companion Animal Veterinarian of the Year. That's like winning the Oscar, the Grammy, the Tony, and whatever the EGOT, whatever the words are. You got that. That means you actually have done a lot for a lot of pets, and she's very humble. But before we keep going, can you tell us about that? That's a big deal.
So Leo K. Bustad is really considered the founder of our focus in veterinary medicine on the human-animal bond. He was a professor at Washington State University College of Veterinary Medicine. And he was really, really focused on articulating and identifying that this precious relationship that we have with animals, that is a reciprocal one, I hasten to add, that this is actually really a piece that is the foundation, literally the foundation of veterinary medicine, that we are all about facilitating, lengthening, and strengthening this precious human-animal bond. And you are correct that the Leo K. Bustad Companion Animal Veterinarian of the Year award is an award that is really considered like the Oscar in veterinary medicine. And really, really just so humbled and just it clearly for me was really the most important formal recognition of the work that I have dedicated my life to, which is all about supporting that precious bond.
I'm laughing because you could be thanking the Academy for all of this. Oh, that was bad, listeners. Sorry about that. Hey, we're talking with Dr. Robin Downing. She heads the Downing Center for Animal Pain Management in Windsor, Colorado. She does a lot for a lot of pets. She is considered the go-to expert on pain management. After we come back from this break, we're going to plunge more into how we can help our cats. What are some things that affect cats' chronic and acute pain? But let's take this break. So sit and purr. We'll be right back. Welcome back to Arden Moore's Four-Legged Life Show. We're speaking with Dr. Robin Downing. She is the founder of the Downing Center for Animal Pain Management in Colorado. Just say her name. I mean, it's kind of weird to be associated with pain. When you say pain, I'm thinking Dr. Robin Downing, but actually it's a compliment to you, Dr. Robin.
And I receive it that way. It's been my pleasure to be able to help change the landscape of animal pain management during the course of my career.
Cats, as we said, are both prey and predator. They're not little dogs. It seems like finally there is a recognition that even cats can get arthritis. And I know they're like little ninjas and they can leap up 5 to 6 times their height and do all these amazing things. But can you tell a little bit about some tips to manage arthritic pain in our cats?
Absolutely. So it's important to understand that across all ages, about 20% of cats actually deal with the chronic pain from osteoarthritis. That's 1 in 5. Now,
That's
as they
amazing.
age, I know it's staggering. And as they age, that percentage becomes higher. And it was very interesting. Now, a study was done at Texas A&M University. A couple of friends of mine were the principal investigators, and they did a retrospective review of x-rays of cats who had been brought to the teaching hospital there, where they just looked for evidence on x-ray of arthritis in various joints.
Okay.
And what they found was in cats over the age of 10, greater than 90% of those cats had arthritis somewhere in their body.
Oh my gosh.
And
Over
that is-
just 10? Wow.
Yes, over 10. And so the thing is staggering about that is to understand that even I'm really aggressive about looking for pain in my patients. Even I'm not treating 90% of my cats over the age of 10 for arthritis pain. However, it raises our sensitivity to making changes, both environmental and lifestyle changes in our cats to help them first of all, to prevent them from getting osteoarthritis.
So what can we do? Yeah.
To delay the onset. And then once they have it, to help them live with it. So several things. The first and most important is making sure they have a normal body composition, that they're not overweight. Every single ounce that they carry that's extra is like number of pounds for us to carry. It is much better for our cats to be built for speed as opposed to being built for comfort. So keeping them lean. The second is to understand that there are tools that we can use to help cats be more comfortable. It's also important to understand that some of those tools don't involve giving a pill, because we all know that cats most cats resent taking a medication. Although there are now some really cool strategies. One of my favorites, and I have no commercial relationship with this company, but I think it's important to mention them. There's a product called Churu, Churu, that comes in little tubes, pureed chicken, pureed tuna. And I will tell you that in my practice, when there are no children present, I call that crystal meth in a tube, because cats think it's great.
Yeah.
And almost any cat in my office will actually eat that in the exam room. And we all know that cats don't like to actually eat when they're away from their house.
Right.
So we do have some strategies for giving oral medications.
I like that.
We also have things like medical massage techniques that I can teach my clients. We also have...
Whoa, slow down. What's a medical massage technique?
There are some very simple massage techniques that are used in human medical massage that have been translated for use in four-legged critters that we can use to help keep muscles limber, to help them stretch, to keep their skin limber. We have to use them judiciously because we don't want to force ourselves on our kitties, but we can really help them with that. And then adapting the environment. So instead of having them go from the floor to the windowsill, that there's an ottoman there that they can go from the floor to the ottoman to the windowsill, so that they're not forced to ask the question of themselves, should I dare to jump all the way into the windowsill?
Yes.
And
that darn robin is taunting me.
Exactly. And so for cat owners not to be afraid if the veterinarian says, there are some medicines now that we have. We have monoclonal antibodies. We have some nutritional supplements that have been proven in clinical studies to decrease inflammation and decrease pain. We do have pharmaceuticals. One of the most important medications in my pharmacy is a drug called gabapentin.
Oh, you had me at G. I love Gabby. Talk about that.
It has helped so many of my cat patients. And my favorite story to tell my cat owners in the exam room is the story of my own cat, Muffin, who came to me at 18 years of age with both torn ACLs and arthritis in her knees so that her knees were fused. She had arthritis in her lower spine, over her hips, along her spine, along her back. She could barely walk. And Muffin, thanks to, I'm glad you're sitting down, 300 milligrams of gabapentin twice a day. That was the dose we had to very slowly increment up to. That was her sweet spot. It gave her the freedom to wander around my 6,000 square foot hospital. And Arden, when Muffin passed away, she was 24 years old.
Pause and applause.
So her pain management didn't just add life to her years.
Gosh.
It added years to her life.
Absolutely.
And so this is why cat owners need to not be intimidated when they find out, hey, your cat is painful and there are things we need to do. Let's work together to find the tools that will work best for this cat in this situation.
Oh my gosh. I'm impressed. 24. Did you change Muffin's name to Methuselah?
Yeah, I felt like I should do that.
There is something wonderful. Listeners, can you feel this? Here is a veterinarian who has dedicated her life to managing pain in cats, dogs. And I just know you have a lot of 2, 3, and 4-legged allies out there. I mean, when you wake up, what's your, we got about 40 seconds left. What's a final message you want to give people? And also let's get them to the key websites for them.
So really my take home message is that all of you who are listening, who have beloved animal family members, need to understand how important it is to partner with your veterinarian to make certain that you discover pain when and where it happens, and that you partner with your veterinarian to find the right tools for your pet, for your cat, for your dog, and that please do not rely on Dr. Google.
Thank goodness. Yeah. So give us the 2 sites.
So websites to think about. One is one of my practice websites, downingcenter.com. There are countless articles to help you with any issues you might have with a cat or a dog. But another very important is the ivapm.org. IVAPM stands for International Veterinary Academy of Pain Management.
I'm so glad they went with initials.
Exactly. The ivapm.org website does have some pet owner-facing materials, as well as ways to find practitioners who are aligned with the International Veterinary Academy of Pain Management.
Thank you. Thank you. Thank you, or as the cats would say, thank you for being a guest on our show, Dr. Robin Downing. And we're going to take a quick break, and we'll be right back, everybody. So sit and stay.
Thanks so much for making our tails wag by watching this guest interview from Arden Moore's Four-Legged Life. Four-Legged Life. Make sure to subscribe so you're up to date with all of our Four-Legged Life content.